everyone. So today with this video we're going to start with a very unique initiative where we are going to solve the last 20 years AIIMS PG and AIIMS questions. This will be a 30-day challenge where we are going to solve all the 20 years question that has been asked. So what will be unique in this initiative? First, we're going to solve the 20 years question. Usually aspirants solve 3 to 4 years paper and they sit in the exam. With this 20 years target, we're going to cover 8,000 questions. So we're going to holistically cover all the questions that have been asked in the previous years. Second, the unique aspect of this is that these questions will be topic wise. None of the platform provides topic wise segregation of the questions. Third, these questions will be provided with precise and easy explanation. And these will be authoritative answers, that is with valid and authentic sources. And the last, that way these can be the last minute capsules, easy to revise and easy to learn. But now you might be thinking, why PYQs? Because around 60 to 80 questions are exactly asked as asked in the previous years. Second, 150 to 170 topics are repeated specifically in the November session. So now let's start with the first topic, and that will be from surgery. So the first thing we're going to do is this instruments in the procedure, which contains approximately 79 questions asked in the last 20 years. Now from this topic, 79 questions have been asked and 66 of them have been asked in the last 12 years. That is most important for you to revise. Now in this video, we have categorized those topics under 12 subtopics. So let's start from the first topic, and that is cannula. So we're going to start from the topic cannula. So from the topic of cannula, 19 questions have been asked. And mostly these questions are in 3 formats. Either they asked you the color and they ask you the size, or they give you the size and they ask you the color. So this is one type of questions that they ask. Second, they specifically ask 3 types of cannulas, and these cannulas are the yellow one, the grey one and the green one. And as most of us know that the green and the grey cannula is for the trauma and the yellow cannula is for the pediatric population. And from this subtopic, they mostly ask the indications of it, either directly or in the clinical format. Third thing, which they have asked only once, they asked the flow rate for one particular cannula, and that was the green cannula. The green cannula. And you all must remember that the green cannula they asked was in the form of a clinical question where they asked the maximum flow rate for that green cannula, and that was 103. See, mostly we study that the green cannula's flow rate on an average is 90 ml per minute. But in that question, it was asked maximum. So the answer was 103 ml per minute. Now let's quickly look about the different types of cannula and their size and flow rate, which they specifically ask. But this we're going to do through a mnemonic, or rather we can say a visual conception, which will help you to memorize better. So look, very easy. We start from here. See, inside the earth, we have an orange color lava. So the first cannula we're going to study is an orange color lava whose size is 14 gauge. Second, thereafter comes soil, which is almost grey in color. So the next cannula is grey. Third, we're going to do green cannula. So grass is green, so we can remember green cannula. Then above grass, we have flowers. So they are pink in color mostly, and therefore pink cannula. After that, we see the sky, which is blue in color, and in the sky we all can also see the sun, which is yellow in color, and above it we can see the universe, which is almost violet in color. So violet cannula, which is 26 gauge. Now a very important thing to remember is कि this cannula is going to be the largest cannula. Largest in sense of its flow rate. Then very important cannulas are the green cannula and the grey cannula. These are specifically asked in the questions because they are used in the trauma settings and they have a faster flow rate because of their wider bore size. So don't get confused about the size. If the gauge is less, the size is going to be large. And then when we come up, we're going to see the cannulas used in the pediatric population. So specifically we use 24 gauge and 26 gauge cannula. These are specifically used in newborns. So let's look at this table now. As I've explained by that mnemonic, we're going to revise it back by this table. See, the 14 gauge is orange cannula, whose flow rate is around 270 ml per minute, and they're specifically used in trauma patients. Then comes the grey and the green cannulas. Recently a new more cannula was introduced, white, but we don't need to remember that. Then the grey cannula and the green cannula are used specifically in the trauma settings. See, the major surgeries and trauma patients. And what is important to remember, I just told you above, was that green cannula's flow rate is 103. This is the maximum flow rate. So maximum flow rate for the green cannula is 103 to 105 ml per minute. And average is around 90 to 96. So this was a bit confusing and this question has been repeated exactly n number of times. Then let's come at the blue, whose flow rate is around 40. This has also been asked multiple times. Then these are the pediatric population. Specifically in the newborn, if they ask, they're going to ask about the yellow one, the pediatric one. This has been recently used, so less commonly used in the clinical settings. So they mostly ask questions about yellow. But you also need to remember about the violet, and you can better memorize by the visual picture that I just explained you. Now let me explain you through the questions that have been asked. Now just examine that nowadays the questions are not asked directly, rather they are asked in a clinical setting way. So see, a patient was received in the casualty with a road traffic accident. He was in shock because his BP was low, heart rate was high, and he had fluid loss. So they showed you a cannula. See, this is the cannula, this is the green one. And they asked you the maximum flow rate of the fluid of the IV cannula. See, most of us studied that the average rate was around 90, but here they asked you about maximum. So the answer would have been 103. It have been 103 to 105 ml per minute. So this was one of the unique questions they asked, and this has been repeated exactly, so you can learn this question by heart. Next, a very important topic, but it's a bit old question, and that is femoral artery cannulization. This has not been asked after 2011, but related questions to femoral artery cannulation in one or the other forms have been asked. So let's quickly see the question. See, they've asked what is not true. That is, they're asking you the wrong statement. So let's first do it. The first statement is common femoral artery is cannulated. Yes, when we do femoral artery cannulation, which is one of the main artery we do in arterial cannulations, and it is commonly done at common femoral artery, which is just below the inguinal ligament here. Second, femoral artery is catheterized at medial third of the femoral head. See, femoral artery passes through the medial third of the femoral head. So this statement is also right. Third, Seldinger's technique is used for femoral artery and vein catheterization. This you can learn, or you can learn it, that this is one of the techniques to catheterize femoral artery and veins. Now the wrong statement here is this single wall puncture is indicated in those with normal coagulation profile. I will quickly explain that there are two ways of catheterizing femoral artery, and that is single wall and double wall. So in single wall, we just puncture the anterior wall, and in double we puncture both the anterior and the posterior. So this we can do in normal individuals, but this is done in patients who have bleeding disorders or other coagulative disorders. Why? Because there are more risk of bleeding if we puncture both the walls. So we prefer single wall in patients who have abnormal coagulation profile. So this statement is saying normal, so this is wrong. So this is a very unique question that was asked. So let's just come back to the next question. Another unique question was asked was OSHO guideline. See, OSHO guideline is related to needle and other sharp injuries. So here they give guidelines on how to deal with it. So first we maintain the records of all injuries, then we provide information and training, and then we do post-exposure prophylaxis. So just remember, OSHO guideline related to needle and other sharp injuries. Let's see another question related to cannulation, which was asked in the form of clinical settings. See, they asked you, which of the following is required for the cannulation of the newborn? See, newborn. So I just now told you that in newborns, we specifically use 24 and 26 gauge. 24 is mostly yellow and 26 is violet. This one is new one, so not used commonly. This one is preferably used, and specifically newborn. In some of the books it is written that we even use the blue one for the pediatric population, but it is pediatric, which is a wider range. In newborns we specifically use 24 and 26. So in this way we eliminate this, and the answer is 24 gauge needle. Definitely we need 5 ml syringe, adhesive tape and normal saline. So the answer is going to be this one, not the one question. So definitely you will definitely need normal saline. Okay. So after finishing the topic of cannula, we're going to start with the next topic, from which a number of questions have been asked, again repeated many times exactly, as well as the topic is repeated and asked in different ways. So the second topic is lumbar puncture. So 11 times this question have been asked, and in 5 different formats they've asked, and the question have been repeated exactly also. So see, this everyone know, because in most of the time in our clinical settings or while doing internship, most of us do the lumbar puncture. So this is a lumbar puncture needle, easily identified. It has a needle and a stillet, so very easy to identify. Right. See, a very important thing is, they've asked that when performing a lumbar puncture, a snap is felt before entering into the epidural space. This is due to piercing of which structure? See, easily explained. Let's do it through this diagram. See, whenever we enter into the epidural space, or the space from which we extract the CSF and that is specifically our subarachnoid space, that is between the arachnoid and the pyometer. So we pierce up to the arachnoid. So the first thing we're going to pierce is skin, then subcutaneous tissue, then supraspinous, intraspinous, ligamentum flavum, dura and arachnoid. See, let's look from this diagram. So we're going to pierce through skin, subcutaneous tissue, then we are going to pierce through this superior spinous ligament this way, and then we're going to pierce through this interspinous ligament. Okay. Then we are going to enter through the ligamentum flavum. When we enter the ligamentum flavum, it gives a flap or a given sign. Okay. If we have done it in the during the internship or in the clinical settings, we can easily recall it, that how this flap is felt. And thereafter we enter into the the subdural space, cross the dura and then arachnoid and enter into subarachnoid space, from where we take the we derive the CSF. So this is important. So the answer of this question was ligamentum flavum. The snap is felt at ligamentum flavum before entering into the dura mater. So this is not going to be the answer. Okay. Another question they have asked is the level of LP. See, very easy to remember that in children the spinal cord ends at L3 and in adults the spinal cord ends at L1. So we're not going to pierce above it or at this level, we're going to go below it having a safe margin, and we're going to pierce at L3, L4 or better L4, L5. So this is the safe place. Both questions have been asked where it ends and at which level we enters. Not only in the AIIMS, also in the NEET PG. This is a very favorite question of both the exams. Let's look at the another question. They again gave the image and they asked what is this needle, and this is again an LP needle, very easy to identify, a needle and a stillet. A needle and a stillet. Now the fourth type of question they asked was, they asked that in which of the conditions LP cannot be done and which of the condition is a contraindication, and one of the question options they gave coagulopathy. Remember, they asked that coagulopathy is not a contraindication. There are 3 contraindications of lumbar puncture, very easy to remember. Thrombocytopenia or other bleeding diathesis, or patient taking anticoagulant therapy, raised intracranial pressure, and third, if there is a suspected epidural abscess. If in the surrounding area there is an inflammation, we are not going to do. So these are the 3. There are other contraindications, but these are the absolute we are not going to do. And for the exam purpose, we are going to remember only these 3 conditions. With fever and nuchal rigidity, the resident was instructed to perform a lumbar puncture on this patient. What is the correct order of managing this patient? So they gave these 4 options and they asked to arrange it. See, the first thing we're going to do is we're going to do a lumbar puncture, right? 4th. Then we're going to send the sample we collected for the CSF. So CSF sample will be derived and it will be sent for the analysis. Then we're going to give an antibiotic dose. Antibiotic dose will be given, which is going to be a broad spectrum. Why? Because according to the protocols, antibiotic dose, if a patient comes with these symptoms in emergency settings, it has to be given within 60 minutes. And thereafter, we're going to start IV cannula and then we're going to give fluids. And this has been shown that if fluids are given within 48 hours, then it is going to reduce the LP side effects. So the sequence would be LP, CSF sample, antibiotic and IV cannula. So this was a confusing point, but remember, first we'll give antibiotic because it has to be given within 60 minutes, and thereafter we're going to put cannula and IV fluids because that takes times. So there is a table in Harrison which is a potential question, which can be a potential questions. So this is that what are the things which can help reduce the incidence of post-LP headache? See, the effective strategies are 4. If we use a atraumatic needle like the Sprott or the Whittaker needle, there are 3 types of needle we all know. So among them, if the Sprott and Whittaker is used, it is going to reduce it. Second, if we replace the stylet before the removal of needle. Third, if we perform the LP in a lateral decubitus position. And fourth, if the needle is inserted in a cephalate to caudate. So this is an effective strategy. But there are certain options which are ineffective strategies, and these are if you give bed rest, or you do immediate mobilization, or you give supplemental fluids, or you minimize the volume of spinal fluid. These are ineffective. Even if you don't do this, it is not going to have any effect on reducing the LP head. Now, since we have completed that LP topic, I have entirely covered all the types of questions that can be asked. and even the potential question. Now let's come back to the third topic, that is the chest tube. So this is the third instrument that is multiple times asked with the images and indirectly also. See, the three types of questions are asked and it has not been repeated much, but we can still do it. So the first is, what is the timing of the removal of chest tube? So a number of options were given, and one of the option was there are two indications when we remove the chest tube. When there is a complete expansion of the lungs on the chest x-ray, or by observing the chest tube drainage bag. If you observe that less than 200 output is draining for two consecutive years, on third day we remove the chest tube. So this was the first question. Second was, they've asked multiple times about the triangle of safety. This is a very important question. See, there are three boundaries: the lateral aspects of the pectoralis muscle, the anterior aspects of the latissimus dorsi, and a line running horizontal at the level of nipple or through the fifth intercostal space. So these are the three borders of triangle of safety, and this is a safe zone where we can insert the chest tube. So look, so this boundaries have been asked multiple times. Third is, the proper functioning of the ICT tube is indicated by. Now this was a very unique question that was asked and has not been repeated also. And how do you check the proper functioning of the ICT tube? By oscillation of the water columns in the tube. So many confuse with this option, continuous air bubbles, but the correct answer is oscillation of the water column in the tube. Now the next topic is the NG tube, the Ryle's tube. So 8 questions have been asked with this topic, and in 3 different ways it has been asked. So the first question they've asked about is the best position for a conscious patient. In a conscious patient, how do you put Ryle's tube? See, these all questions are becoming more clinical. The more you go to the wards, more you go to the emergency settings, more you learn about the techniques, and that way you can better answer these questions. So the answer for this question, that is what is the best position in a conscious, is sitting with neck flexion. So if you flex your neck, the Ryle's tube go inside better, because your esophagus is straightened up because of that. Second question is correct method of measurement of NG tube. So the correct method of measurement is, you take from the tip of your nose to your ear lobule to the Ziffy sternum, the end of the sternum. This is the correct way of measuring the NG tube. This way, sorry. And one more question was asked, which was asked a little bit earlier, that what will be the measurement if we do it for transpyloric feeds? So that will extend till umbilicus. So we are going to measure till umbilicus and then we are going to insert it. So that will be umbilicus. And here it is Ziffy. For transpyloric it will be umbilicus. Same question asked in a different way. They showed 4 images and they asked arrange them. So we can see this is the Ryle's one. How do you identify it? See, there are markings. 3 markings are there. 1, 2 and 3 markings are there. Other way to identify it, there will be a green line that will indicate the radio labeled line. That way also you can indicate inside, but most of the time it's not visible. But you can look at the markings here. That way you will identify that this is a Ryle's tube. Second, this is the chest tube, the intercostal chest tube. How will you identify it from other bags? Like this one is the urine bag. Similarly, we also have an abdominal bag, but this is a uro bag. Both of them are similar. The chest tube is that here, look, the tube is going till the down for the underwater bag. So this way you will be able to identify. And the fourth will be this metal cannula. So this is a suction metal cannula. This is used for suctioning all the infectious fluid that comes after the surgery. So you can quickly have a glance of all the 4 images because these are asked in the image sections multiple times. Now let's come to the 5th topic, and that is the Foley's catheter. See, 6 times these questions have been asked, and mostly they asked one question, and that is what is this FR in this Foley's catheter. Okay, so FR stands for French, and this is basically stands for outer diameter. Now this is a very important thing, and when we say 1 French, we say 0.33 millimeter outer diameter. So if they say, let's say they say this is an 18 French Foley's catheter, that means that this 18 represents the circumference. So that will be 18 mm. But this French will represent that the outer diameter will be 0.33 mm of 18. That is 1/3 of 18 going to be 6 mm. Similarly for others. Now another question that has been asked from this is the color coding. So mostly they ask about the orange color. Let's look from this diagram, and this is a mnemonic here we have made, and this is gory PB. See, gory PB. See, G for green, O for orange, red, yellow, P for purple or violet, and B for blue. So gory PB, and this is from 14 French to 24 French. Okay, the last is 24 and first is 14. So easily you can remember 14 to 24. Okay, 14 to 24. So mostly they ask orange. See, orange, and this is 16. So once again I'll show you this, and you can revise, or you can learn from this. See, mostly they ask from this area. So they ask green, orange, red, yellow, violet. So gory PB. This is the mnemonic. Now let's look how they are asking in a clinical setting form. See, after a surgery, the surgeon asked the intern to remove the Foley's catheter, but he could not do it. The surgeon himself tried to remove the Foley's catheter, but he was unsuccessful. What should be done next? So this was a unique question that was asked, and the answer to this will be that we are going to use an ultrasound guidance to locate, and then we're going to prick the balloon, and then we're going to remove the catheter. See, other things you're not going to do, like CT, because you don't have time, inject ether, no, and then water to over distance. This is also not we're going to do because it can harm. So this is the best method, ultrasound guide. Next topic is Fogarty's catheter. Mostly this question is not asked. It was asked before 2010, and the only question was asked was for what it is used for. It's a specific kind of catheter used in embolectomies. Let's go to the next topic. So the next topic is important, bone marrow and fnac. 8 questions have been asked in 4 different unique ways, and these are repeated. I'm again saying that these questions are repeated exactly also, and you can analyze by looking at the authentic sources. So the first question is, all these are true about the procedure in which this needle is used except. See, first of all, you need to identify that this is a bone marrow needle. So what is wrong is being asked. So the answer here is the platelet count of less than 40,000 is contraindication. This is a wrong statement, because the indication for bone marrow is to identify the cause of thrombocytopenia. See, this can be confusing because mostly we are taught that in severe thrombocytopenia bone marrow should not be done, but they have said 40,000. The criteria we take is 20,000 for severe. So this is a wrong statement. We can do bone marrow if biopsy if platelet count is less than 40. So we avoid below 20,000, but we can do. So this is not a absolute contraindication. Other procedures are no breath holding is required. That's a correct statement. It is useful in the diagnosis of infiltrating and granulomatous disorders. There are a number of indications for a bone marrow biopsy, and one of them is these. And fourth, this can be done in prone and lateral position. Everyone of us know that these are done when the patient is asked to lie in the prone position from posterior superior iliac spine. This is the location where we do it, and we need to remember is कि the bone marrow biopsy is contraindicated in 3 conditions. Okay, in severe hemophilia, in severe DIC, and in severe bleeding disorder. I'm saying severe, but this is not an absolute one, and the mark also is also 20,000 se kam. So since they have asked 40,000, so this is not going to be the answer. And certain other points that are important about this is that why this is not a contraindication, because if you apply prolonged pressure, this can be stopped. The bleeding can be stopped even if it occurs. Other type of question has been asked about the type of needles. Now this has been asked specifically about Jamshidi. This question has been asked multiple times, that they've shown the Jamshidi needle, which is made up of slightly of plastic and all. So this is a new type of needle, so very easy to identify Jamshidi needle. I showed you the image above as well. Second needle they have asked directly was the Klima needle. So they showed you the Klima needle. See, you can see how will you differentiate. This is plastic. This is one, and here you can further go with the stylus, style it, so you can easily identify it. And third is the Sala. Sala is for sternum puncture. How will you remember? S for Sala, S for sternum. And how will you identify in the image? You can see here you have a screw type of something. So that way grossly you can recall it. This is Sala. There is one more type of needle, the Islam needle. That is very similar to the Jamshidi needle, the Islam needle. Alright. And that is not asked, but this was given in one of the options. So it can be asked in the future. So look at this. This is a vacutainer, and I'm showing you the different additives and the uses of it. See, first is the purple color, and the additive uses EDT, and it is used for CBC, and this is a very common vial that we use because all the time we have to take the CBC. Second is the blue color, and blue color you all know there is a marking at the top, and we have to fill till the top, and is specifically used for coagulation studies and ESR by Western grain, not by the other method. Just remember Western grain method. Then is the gray. So here we using sodium fluoride and potassium oxalate because this is used for blood glucose के लिए. So blood glucose के लिए we use sodium fluoride, and it is going to inhibit the glycolysis. And that way we can detect, because no further metabolism of glucose will occur. Now next is the red color. And red, you can remember like that, that in emergency settings, red is the indication. And in that, we don't have time, so there is no additive to add. So no additive is used here, and is used for the collection of serum, because we collect the blood and all. So for the collection of serum studies के लिए, we use red. Okay. Next is the yellow one, and yellow is used for, specifically in the blood banks. Blood banks में it is used for the preservation of RBC for blood banking and HLA typing. So you can remember, like in blood bank, we mostly don't get the blood whenever we ask for as an intern. So they're yellow, a little bit of emergency. Now next is the green color. Here heparin is used, ABG, osmotic fragility, immunophenotyping and leukocyte function test. This has also been asked, and that is why I'm telling you to remember all the four: osmotic fragility, ABG, leukocyte function test, and immunophenotyping. Now let's come back to the question. The first question is anticoagulant used to estimate the glucose from a sample sent for PHC. So they're asking clinical questions. So, for glucose estimation, I told you we're going to use the gray one, and it will have potassium oxalate and sodium fluoride. So it is going to have potassium oxalate and sodium fluoride. This is going to inhibit glycolysis. Now next question is, what is the anticoagulant of choice for coagulation? So anticoagulant for choice for coagulation, I told you, for coagulation studies we use the blue one, and there we use 3.2% trisodium. This we not only do for coagulation studies, but also for ESR testing. The next question, they showed this vacutainer. So see, this is a red one, and I told you that red one is an emergency, it will not have any additive. But they're asked the question that what they asked 4 questions and 4 options, and they showed what does it contain. it contains clot activator in the form of silica. See, I told you no additives or anticoagulant, but it has clot activator silica. Why does not it has any anticoagulant? Because we want to clot the sample. We want the sample to clot so that we can analyze the serum, right? So for that we want that the clotting cascade should start. For that we use a clot activator silica. Which of the following is the color of the vacutainer containing sodium fluoride? So again the same question, grey color, because sodium inhibits glycolysis. It is used for estimation of blood glucose. Very uniquely you can remember it can also be used to estimate alcohol. Now they asked that identify the correct procedures. Now this was also a clinical question, a pure clinical questions. The number of times we collect the sample, the more better we learn this procedure. See, fill the laboratory requisite forms, identify the patient, bedside blood collection, and label the sample. So this is the sequence in which we do. We first fill the form, we then identify the patient, do the bedside blood collection, and then lastly we label the sample. So you're not going to fill the form at last, you're going to fill the form at first. A very important, but very general statement I'll say, that when do you wear the gloves? After you apply the tourniquet. After applying the tourniquet, then you wear the gloves, and after you wear the gloves, then you will apply the alcohol rub, and thereafter you will not touch the site of aspiration of the blood. So the next question, which anticoagulant is used for electrolyte estimation? I told you electrolyte, the 4 indications, heparin. This was the green one. The green one. I can show you this table again and you can quickly have a glance through this table. You can pause the video and look at it. Next topic is the blood spill. This is a miscellaneous topic, but questions have been asked. See, 5 questions have been asked in 3 different ways, repeated number of times. First, a blood spill in the operation theatre must be cleaned with, see, whenever there is a blood spill in the operation theatre, we use a chlorine compounds. We always use chlorine. So there were 4 options that were given, like chlorine, bromine. So the answer is chlorine, because chlorine is the best disinfectant for the surface blood spill in the concentration of this. So the next thing they asked, the next year actually they asked similar question. While collecting the blood for samples, you have spilled same on the floor. What will be the immediate next step? See, here the answer changes. It will not be using the chlorine compound. First, it's very easy. First, you are going to clean that sample, no? And then you are going to use the disinfectant. You are not going to use disinfectant directly on the blood. So you will use clean with absorbable. So answer of this question was clean with absorbable. And after you clean it, then you add disinfectant on that area with chlorine compounds. And thereafter you do this. This absorbable material is then discarded in the yellow bin. This is also very important because in PSM they ask you about the different types of bins and their materials you put. Another question they have asked is the concentration of sodium hypochlorite. Now this is important. If the blood sample is less than 10 ml, we are going to use 1:100 dilution to decontaminate the non-porous surface, and this is around approximately 5%. When the sample is more than 10% or it is a cultural spill, we are going to use 1:10 dilution in the first application. Pehle you are going to use 1:10, which is 5%. Sorry, this was 0.5%. I'm really sorry. And this was 5%. And thereafter in the second application, you will use a diluted form 1:100, and this is going to be 0.5%. Next, you are measuring a patient's BP at a PHC with a sphygmomanometer. It broke down and mercury was spilled onto the ground. How will you clean? Okay. See, it was a very easy question. You could have eliminated the other options and then you would have derived at the question. See, first, collect it by using a cardboard. Let's see. Collect it by sweeping with the broom and throw it outside. You won't like to contaminate the environment, so you won't throw it outside, because mercury is a heavy metal and can easily contaminate the ground as well as the soil, and can cause toxicity at very low levels. Third, collect it and by sweeping it and flush it in the toilet. See, toilet mein flush karne se you will contaminate water. You won't do it. This is wrong. Collect it by hand. See, mercury is easily absorbed through your skin, so you won't ever use it. So the only option left is this. Collect it using a cardboard and put it into a jar. So this is the correct answer. So see, we have finished the topic of instruments and procedures. Similarly, we are going to do the next topic in the next video. Till then, please don't forget to share, like and subscribe this video. And we would also like to receive your opinions about how we can improve. So till then, continue watching further such videos so that you can easily memorize them at last time.